Okay, good afternoon, everyone. Thank you for joining us. My name is Isaac Dano, and I lead our communications here at the Department of Corrections. I think we have got almost everybody, so we are going to get started here. We'll just do some quick introductions, so I'm going to hand it over to Commissioner Demmel.
Hey, good afternoon. My name is Nick Demmel. I'm the Commissioner of the Vermont Department of Corrections.
Great, thank you, Commissioner. And I'm going to hand it over now to our UVM partners. Abby?
Hi, I'm Abby Crocker. I'm a Research Associate Professor of Statistics at the University of Vermont and a research partner as part of the study. And pass it to my partner, Kathy.
Hi, I'm Kathy Fox. I'm a professor of sociology at UVM, and I'm the other half of the research enterprise that conducted the study.
Great. Thank you, Kathy. And Brad, would you mind going?
Sure, I'm Brad Goodhale. I'm the Prison Research and Innovation Manager here at Southern, managing the project for DOC, otherwise known as the PRIM.
Great, thank you. And Jesse?
Hey everyone, I'm Jesse Janetta. I'm a Senior Policy Fellow at the Justice Policy Center at the Urban Institute in Washington, D.C., and I've been leading our engagement with Vermont for the Prison Research and Innovation Network project.
Great. Thank you, Jesse. And we've got a few more DOC folks on the line, and they may chime in later, and we'll introduce them if they decide to respond. But I wanted to hand it over now to Commissioner Demmel. Commissioner, the floor is yours.
Great. Thanks again, Isaac. And good afternoon again, everybody. Thank you for joining us today. I think it's a pretty exciting opportunity to get together again about a year after we did this in 22 to talk about the latest results from the Prison Research Innovation Network surveys that are conducted at our facility in Springfield, Southern State Correctional Facility. I'm going to give just a brief overview of the project, talk about the timelines to this point, and then I'll hand it over to some of my colleagues, first to UVM and Urban to talk about the methodology of PRIN, and then to our UVM colleagues to talk about some of the results this year. I'll bring it back and talk just a couple of minutes about some of the things that the department has started as a result of this project, some of the key data we're taking away from it, and then certainly I think the body of the time will dedicate to a question and answer session to make sure we get to address all your questions, and certainly happy to do follow-ups after this event as well. So as those of you who were here last year will remember, the Prison Research Innovation Network is a partnership between the Vermont Department of Corrections, the University of Vermont, and the Urban Institute to really study the correction system in Vermont, and then Urban is doing this with 4 other states across the country to really understand some of the more vexing challenges that are faced by correction systems, by incarcerated individuals, by correction staff around the country. Vermont's excited to be on the front end of this. This is, I think, and Jesse can confirm this for us, but Vermont was the first to release its first set of data last year. I think we're on the front end of that again this year, really kind of blazing the trail here nationally on this project. And I also wanted to highlight that this was a voluntary effort by the state of Vermont to take this on. We applied to the program. We were excited to be selected as one of the 5 states, excited to be out in front and trying to really push hard on staying on the front end of this. But I think it's important to highlight that it's voluntary because this was a commitment by the state of Vermont to really truly understand the problems we're facing in the correction system and find ways to innovate and be creative, create national best practices in corrections, and really improve our system for those that are in our care and custody, for our staff, and make sure that we're best serving the needs of the state of Vermont. So these surveys are conducted annually. They're administered by our UVM colleagues and with help from the Urban Institute, and they're conducted both of our staff and of the incarcerated individuals at Southern State. That's an interesting facility for us for a lot of reasons that we'd be excited to talk about. But really, the population there is diverse and is unique. We have our aging population there. We have our really acute mental health patients down there. We have other individuals with physical health needs, and we have a general population that matches some of our other locations. And so it's an interesting place to be able to conduct these surveys. And we're really excited by some of the work that's been done so far. There are 4 principal goals of the project. The first is to understand prison environments and the safety and well-being of those who live and work there. I alluded to some of that. The second is helping prisons to collect data and promote transparency and accountability. This is something the department has really strived to commit to over the last several years, is to promote transparency and accountability within our own system. This is just another tool that we're able to use to do that. The third is supporting evidence-based changes to improve prisons and ensure safe and humane environments for all. And the fourth is to develop data-driven recommendations for the facility and for the department and promote those improvements system-wide. We think we're achieving those objectives and we've got room to grow, but we're excited by the progress we're making so far. So to give you just a reminder of the timeline we've been on, in the summer of 2021, we conducted the first round of surveys. Those surveys were released in January of 22, and we held an event similar to this one at that time. The second round of surveys, the surveys that we released yesterday, were conducted in June of 2022, and we released them yesterday. The next round will occur in this coming summer, but in between, I think it's important to highlight that in between the survey periods is really the critical period of work that we get to do down at Southern with some of the innovations and the innovation councils that we'll talk about today. So that's the point we're at right now. We're releasing the second round of surveys. We did that yesterday, here to talk about those, and we'll give you some key highlights in a moment. But for now, I will pause and hand it to our friends. I think, Jesse, over to you.
Yes, thanks, Commissioner Demmel. So I'm going to do a little bit of further detail and kind of context setting about how the structure of the PRIN work is set up to use the data that we'll be talking about today as part of change processes. As I mentioned, the Urban Institute is the organization operating PRIN at the national level, working with Vermont as well as Colorado, Delaware, Iowa, and Missouri, the other sites that are participating. The commissioner is correct. Vermont is the furthest along in this wave of data collection. Missouri, very close behind, just about done with their analysis of the second wave. Every PRIN participating state DOC designated one facility, a pilot facility, to be the primary focus and host for the research and the change work. That's Southern here in Vermont, and there's a local research partner in each of those states, as UVM is here in Vermont. So the way that the project is structured and intending to use research to make the kinds of changes that the goals of the project lay out is starting with foundational research to help assist with problem identification and prioritization. The climate surveys that we're talking about today are the primary form of that, developed in close collaboration with the staff and with people incarcerated at Southern so that their sense of what the priority issues are was guiding not only the interpretation of the data, but really what kinds of questions, what investigation was going to be done. And then building on that foundational work is then identifying what are some specific changes and innovations that might be made in an attempt to address the issues being laid out in the data. And then having that data structure in place is then an opportunity for ongoing measurement to see what is happening around the problems and challenges that we're all working towards through the PRIN. Vermont applied to be part of this project in 2019, coming with the challenges and issues that they wanted to work on, that they felt PRIN could help Vermont make progress on. This was the pre-pandemic world. COVID-19 in all its impacts, I think, has probably made literally every single one of those issues more challenging to deal with and added some for good measure. And I do think that, as we look at the data here, it's important to think about the fact that, well, the public health situation around COVID has mitigated and improved in many ways. A lot of the impacts of COVID on institutions, and we see this a lot in workforce, not only in corrections, but in other places, in a lot of ways continue to intensify in 2022. Just from a national perspective, the staffing around corrections agencies is being discussed as a crisis from coast to coast. And that is something, when you are looking at staffing shortages, it affects everything that happens in a correctional facility. So I think that is important context around timeline. I will say you can think about, talking about the sort of change in innovation work that PRIN is contributing to at two levels. One is at the pilot facility at Southern, having locally derived innovations and efforts that are being conceived and piloted there. For example, Southern launched an honors unit in the facility, which has a lot of benefits, both for people who are incarcerated who are there in the unit, but also for staff in the way that they need to engage around that. I'd also highlight the incarcerated advisors at Southern have been working in collaboration with the chief of security at Southern on an effort to systematically look at the parameters of allowable property for incarcerated people and some of the ways that their cells are configured, very concrete things about, the day-to-day conditions for people there, and worked out a number of recommendations that are being considered now. So these are examples of some of the bottom-up work at Southern that is attached to PRIN. And then there are a wide array of DOC and system-wide initiatives. These are things that were largely or maybe entirely going to happen anyway, but what PRIN brought to the table is some data and guidance to help inform and shape those efforts. And to name one quickly, the stability and sustainability plan to address staff attrition and turnover and short staffing is one that, I understand from DOC leadership, PRIN data was helpful as a contribution and input into shaping what that looks like. I would say, in addition to the research work, the change work has been happening throughout 2022. A lot of it, sort of showing up concretely and really bearing fruit, more recently in the second half of the year. I had the opportunity to be on site at Southern in both June of 22, right on the cusp of doing the survey, and then last month in December. And, as you can see in the survey results, a lot of real challenges around what we're trying to deal with. I think we all feel tasked by, the severity of a lot of the issues that need to be dealt with. But it was exciting to be in Southern and see a number of things that in June were like, maybe this could happen, or it's on the list of things to consider, had happened and were underway. I think some of the new staff from the academy were at Southern. The new, schedule was just being implemented. And so it was sort of early days, but I as an outsider came in, and the tenor of how things felt at Southern, I thought was noticeably different in December. Still early days, maybe guarded optimism to the extent that optimism was there, but I think, a sense of also momentum, which is good because the work we have to do, as the data is showing, is pretty serious. But, again, like this is part of a process of continually pushing to try and get these challenges going in the right direction. So with that as broad context, I'll hand it off to my colleagues at UVM to drill down a little bit more into the data that we'll be talking about today.
Hi, Kathy Fox again. I'm just going to talk for a few minutes about the methodology, and then I'm happy to answer other questions, but I'll make it quick so we can move along. So one of the benefits and ideas behind the PRIN project is transparency. And so as independent researchers, we contribute to that in the sense that, we are able to foster a fair amount of trust with people inside because we are independent, and, DOC doesn't see our raw data. And I think evidence of that trust is that we have a very high response rate and completion rate of the survey. So this year we had 72% of incarcerated people complete the survey and 65% of staff. And that's actually very high. So we felt good about that. And I think part of that is that we've been able to establish an independent relationship in this process. The other thing is that we, and Jesse alluded to this, we engage in what's called community-based participatory research, which is elevating the voices of people that are affected, so incarcerated people and staff, in every stage of the process. So early on, we did focus groups and interviews, and they helped us identify the issues. And then we got their feedback on the survey. So they influenced the content of the survey tremendously. And the surveys are 130 plus questions each. So we really get into some pretty significant detail about, every aspect of their lives. And then we share the data with them. We get their feedback on it. So it's this iterative process. The next stage for us is to do a bunch more qualitative work, which is, I'm the qualitative researcher. I do focus groups and interviews. Abby is the statistician. So we're a good team that way. But the point will be to talk to people and ask them to help us understand the context of the findings of the surveys. So we'll be doing that over, the next many months. And I guess I'll let Abby talk about the results, and happy to answer any questions.
Sure. So thanks everybody for being here today. I'm really excited to be able to be at this point in the project where we're talking about the results and moving into sort of public discussion around what comes next. As Kathy sort of alluded to, Kathy stated, was the surveys themselves are really comprehensive, and I hope you've had a chance to see them because they're on our website, in their entirety. And the questions themselves were created by the discussions from the folks we've had inside, and as a result, we really think they're an accurate representation of what life is like inside the facility for the staff and for the incarcerated. And now that we've been able to actually see the results of these surveys for 2 years, we're getting this more accurate, transparent picture of what it's truly like in there. And what we've seen, at least in this 2022 data, is just it's an environment that's very stressful for staff and incarcerated. And some of the things that really stand out in the results are the mental health, the physical health, the social health impacts of working or being incarcerated in a facility. I think one of the alarming things for everyone is sort of the rates of suicidal ideation for both staff and incarcerated. And what we saw in the 2022 survey for staff was that rate was 30%. And for incarcerated, it was 37%. And those are really high. I think, those are really high in general, and they're high for incarcerated and correctional staff populations as well. What we see really in the staff population is, mental health showing up not only in suicidal ideation, but also in rates of depression and anxiety. We see notable rates, responses indicating that working in correctional facilities really has introduced this conflict with home environments. Something that really stood out in the 2022 survey results was the 100% of staff reporting that their coworkers show signs of stress. So those were big things that came out, and we see sort of similar issues showing up in the incarcerated population. But the key things that really elevated for the incarcerated population results in 2022 related to idle time, like not having anything to do all day, and really what the repercussions of that are and what the impact of that is, and how not having anything to do all day doesn't really help people get prepared for release and really coming back into the population, into their communities, how they're not really set up for that. And also what the issues are, and you're thinking about idle time and how that presents itself in issues around negative behaviors inside the facility. And, that sort of has this sort of cycle of negative behaviors, feeding issues for staff, feeding, just this whole sort of environment inside the facility that can be really challenging. Other things that really stood out for incarcerated folks around idle time, not feeling prepared for release, but also sort of concerns around access to healthcare services. And so those were sort of the big issues that stood out in 2022. What is interesting to note in the incarcerated person's results is when asked sort of, okay, you've got a lot of idle time, there's not much to do. What do you want to do? What are the things you need to help fill your time and get prepared for release? The big responses were really around job training and connection with community services and ability to give back. And that's something in itself that's really important for preparing people for release, is staying connected with community, their families, feeling like they are still part of, Vermont outside of these prison walls. And, that's challenging. And I think that really presented itself as a challenge, especially during COVID. And we're really seeing those challenges, present themselves in sort of the mental health impacts of the incarcerated population today. And as we think about that in terms of, connection with community and the impacts that COVID has had on this facility, the impacts that COVID's had on the Vermont facilities, they've happened, like Jesse mentioned, across all facilities and sort of the whole country. And what COVID really has done is really highlighted the issues that have already existed in corrections. And what are we going to do about that? And so I think what's unique about Vermont, when we think about how we can use this information, not only to drive a local conversation, but also a national conversation about sort of the role of corrections, and how we operate within our facilities and connect to our communities around them. What we see is that incarceration and corrections is really sort of grounded in a public health concern, and it happens inside a facility as well as the connections outside of the facility. And in Vermont in particular, we're uniquely set up because we're the only Department of Corrections that's inside an agency of human services. So our opportunity to connect with sort of the folks around, the things that drive what feeds into corrections and where you go outside of corrections is really there. And I think that's important because we see some of the issues inside the facility are issues that aren't actually stemming from inside corrections. And I think you can really see that in the incarcerated data when we look at sort of adverse childhood experiences and the issues that incarcerated folks present with inside the facilities have sort of a long history. And we know that the data show us that 40% of the current incarcerated population at Southern, they themselves had a parent who was incarcerated. So when we think about opportunity to think about corrections in this larger public health system, it's important to think about what happens before corrections, as well as what happens inside of a facility. So I'll pass it back.
Great, thank you, Abby. And now I'm going to turn it back over to Commissioner Demmel to talk about some next steps.
Yeah, thank you very much, both to our colleagues at Urban and to UVM. Really have appreciated the partnership and the collaboration throughout the effort. As Abby just highlighted, I mean, I think we need to call out and be transparent about the fact that the overall trend lines were negative in many categories. And I think particularly when we look at wellness and mental health, both of our staff and of the incarcerated populations. There were some positive signs on the staff side. We saw most staff reported that they felt that there was equitable treatment regardless of race or ethnicity, age, gender, sexual orientation, religion, or disability. And we're happy to see that. But at the end of the day, I think what these results highlighted to us and built on the results we had last year is there are real structural challenges that we have to face as a state and as a department to try to fix some of this. I also think, and I think it's the perception, at least within the Department of Corrections, that these problems that are highlighted in the survey results are persistent problems throughout the United States in correction settings. And while I am very concerned by the data and the results that we saw, I'm very proud of Vermont for being willing to pull the curtain back on this and say, we want to understand those problems and we want to go try to fix them. And then with our partners from UVM and from Urban, with our staff in the facilities and with our incarcerated partners, really trying to come up with new ways to approach what are generations long problems that have been in the system for a long time. I just wanted to quickly highlight a couple of the things that the department has done to really tackle this already. And I think it's worth just providing one additional piece of context, and that is Vermont took a very thoughtful and very aggressive approach to mitigating the impact of COVID-19 in our prison system. As a result of that, we are the only state in the country that had no deaths amongst incarcerated individuals or our staff as a result of COVID-19. But that came at a cost as well. And I think these survey results highlight some of that. You know, there was a physical health, a mental health, an emotional health cost to some of the mitigation measures we took. And now as we've emerged and we start to recover from the pandemic, I think our attention very much needs to be focused on addressing those impacts and really helping folks to become well, focusing on mental health and the emotional health, addressing trauma that's occurred in our system. It's one of the reasons that this year Vermont put its healthcare contract for the prison system up for bid, and will be writing a new contract with the selected bidder here shortly. I think one of the things we identified was the mental health landscape has changed dramatically from before COVID to where we are today, and our contract and the provision of healthcare in our system needed to adjust to that reality. And so we look to focus our next healthcare contract heavily on mental health and emotional health for the incarcerated population, and we hope that we can focus in on some of the real pain points that's driving some of the survey results we saw today. On our staff side, I think Jesse alluded to this. Over the summer, we launched the Stability and Sustainability Plan. It really was an effort to tackle some of the systemic staffing challenges we were facing, but also to refocus the department and show a reinvestment in our staff. As part of that plan, we moved 4 of our 6 facilities to a 50-50 schedule where staff only work 7 out of 14 days in a pay period. That means that half of the year they're at work and half the year they're at home or out doing other activities, hobbies, spending time with family. And that was really driven by the prison work. I mean, what we found in the original surveys and what was confirmed in this survey was staff want a work-life balance. They need more time to recover from work, and prison environments are a difficult environment to work in. And so we needed to meet them there and provide that opportunity for them to be away from the facilities. We hope to move all 6 of our facilities, so the remaining 2, by later in the spring to the 50-50 schedule. And we're already seeing very positive results with staff out of that approach. And that happened in September, so it's not captured in this year's survey data, but we look forward to seeing that in future data. Since that plan went into effect, we also had a 5% decrease in our vacancy rate. We're seeing the largest recruiting classes we've ever seen. After this plan went into effect, we had the largest academy class ever with more than 50 recruits who graduated. We also restructured the office that addresses our staff and really focused the office on the staff experience from the minute you get recruited until the minute you retire, and providing a full suite of wraparound services to include professional development, recruitment and retention work, staff wellness and health, rewards and recognition work, and process improvement to really improve the staff experience. Recognizing it's a tough job, how can we do better to meet the staff and help improve the situation for them? And now we've just launched a new phase of this that will focus on our field staff, who are picking up some of the burdens that have been shifted out of the facilities because they've been so overburdened. In the year ahead, we hope to focus pretty heavily on communication with our staff. And we saw that frequently in the survey results that line staff around the department did not feel the department was communicating with them enough. And that's something we hope to improve on. We've also launched surveys that the department will run in between this survey to better capture data and have a more real-time pulse on staff and figure out where pain points are happening so we can target them with some solutions. We continue to do a monthly town hall We have an open question and answer forum during that session. And we also have direct lines of communication from any staff member of the department to the commissioner's office so that their voices can be heard and incorporated into the decision-making process. I was very excited. Southern is one of the locations. We also have one at the Chittenden facility in South Burlington, but we're rolling out honors units where we provide the incarcerated population with a semi-autonomous environment where they self-govern. Periodic tours are done, but individuals earn their way in and then have more freedoms and flexibility within the living unit. And we've seen a great positive result from incarcerated individuals at both those facilities. And hopefully we can launch more of those in the year ahead. And then we focused heavily on our suicide contemplation issue. And that's on both sides of the equation for the incarcerated and for staff. We immediately launched a suicide advisory panel that is helping both line staff, supervisors, and mental health professionals to try to find solutions to address some of the underlying causes of suicide ideation amongst our staff and amongst the incarcerated. And we're looking to expand other programs that directly target the mental health concerns that we have. And largely for the incarcerated, that'll be done through our next healthcare provider. So with that, I'll pause there because I want to save the body of our time for questions and answers. But again, thank you all for joining, and thanks to our partners at both the University of Vermont and at the Urban Institute.
Great. Thank you, Commissioner. All right, now we're going to move to the question and answer period. We have a few folks who have requested time for questions, and then we'll move to the open floor model. So first, I'm going to ask Liam from Vermont Public. Liam, if you have a question or two.
Yeah, sure. Thanks for making the time. I was just wondering, Nick, you were kind of going over some of the things the department is thinking about doing, and I just was wondering if there's anything more specific you could say about addressing the sort of mental health needs of the incarcerated population. You were starting to get there a little bit, but I just was wondering if there's anything more specific you could give us about how you're going to address those issues.
Yeah, excellent question, and thank you for asking. So I think, the one thing that we focused really heavily on is designing a new healthcare plan. In the Department of Corrections, healthcare is provided by an outside contractor. And so the rules that govern that provision of healthcare are really set by the contract that we design. And so as we sat down to redesign the contract for the next vendor, really we put an emphasis on mental health. And then that's getting more mental health practitioners into the system, finding other ways for incarcerated individuals to gain access to mental health care, whether that's through telemedicine. There's some offerings on our tablet system, programs that people can access, but really building that out, recognizing in many ways it's just as important as physical healthcare, and we need to prioritize it that way. And so we did that through the contract. The new healthcare provider will be starting in summer of this year, and so we hope to have that up and running a little later in the summer. We also, as I mentioned, Liam, we have our suicide advisory prevention panel, and their focus is really to take these survey results, look at root causes, and see if there aren't ways that we can design solutions around that. And we thought that was important to bring in line staff in addition to mental health practitioners, because we want to make sure that the full experience of a corrections officer, or what the experience is like in one of the facilities, is accounted for, and not simply just kind of an academic answer, but really bring in some experience to advise how we could create solutions. We're also changing our suicide prevention policy, and we're putting finishing touches on that and hope to promulgate that in the next couple of weeks. And that outlines our approach to suicide prevention, steps we're taking, response times, how we address suicide activity. And so hopefully we get that out. And then, at a less clinical or less health-focused approach, I think the department is spending a lot of time right now figuring out how we can engage the incarcerated individual so that they don't feel like it's just dead time, or that there's just no activity, no vocational training, all of these different, we have a huge opportunity to spend time with the individuals when they're in our care and custody to prepare them for whatever the next chapter is, to help them successfully re-enter, whether that's job skills, education, or the mental health care work. I think all of that will help to mitigate against the suicide ideation. And I think we need to find ways to get folks engaged and find things that meet them at their place and what they're interested in. And I think whether it's the vocational training, whether it's education, or simply just other activities, we need to find ways to inject that into our system. And so we're spending a lot of time contemplating that right now and hope to have projects this spring that we can launch to address some of that.
On the new medical provider contract, is that essentially you're requiring that they provide more mental health services? Does that mean that like the current contract doesn't include as much for mental health services? I guess just trying to understand more what's going to be different in the summer when the new provider takes over. Is it that there be more mental health staff available? All people get appointments? How is that working?
Yeah, so there are mental health providers included in the current contract that are provided by the current vendor. But I think what we saw is, the contract was designed in a pre-COVID world, and I think really in the mental health space, that battle space has changed completely since the end of since COVID really slowed down and we kind of emerged into the state that we're in now. And so and that's true of physical healthcare also, but I think particularly for mental health care. So we recognize that the contract we had in place wasn't fulfilling the full suite of needs that we think we need to fulfill. So it does mean more access to mental health care providers, but really, as you probably well know, there's a limit to how many mental health providers are available in the state of Vermont. And so knowing there are these natural limitations on what we can provide, we need to find other ways to gain access to healthcare. And so I think telemedicine was a huge thing that we started to pursue and wanted to understand what was out there, how could we bring those inside the walls of a correctional facility, and expanding other types of programs that we have behind the walls that get people connected with mental health care, whether it's kind of a peer support model using, we have Open Ears Coaches, which is a program that we run within the facilities, where an incarcerated individual goes through some training and then is able to be a mentor, a support mechanism for other incarcerated individuals. Whether we need to find more programs like that or expand those programs, I think that's what we're contemplating to really hit mental health from every side that we can and move the needle on these kind of scary results as it relates to the mental health.
Okay, thank you. And then briefly, just who's the new vendor for the healthcare services?
So that is still under negotiation. It hasn't been selected yet, but we'll be sure to put that out as soon as that process is finalized.
Thanks.
Yep.
Thanks, Liam. Next, Derek from 7 Days.
Hi, thank you for holding this opportunity to learn more about the survey. I appreciate that. First question, a couple here for the commissioner, I think. Could you explain a little bit more about the Suicide Prevention Advisory Panel? What had prompted the department to form that and when?
Yeah, great question. So the Suicide Prevention Advisory Panel was formed just after the results came out last year. So we'd set up kind of an immediate task group to look at the initial results and give us a sense of how we could design a team to respond to that. That group was in place for about 30 days at the end of 21, beginning of 22. And then that resulted in the stand-up of a permanent larger panel in early 22, I think January timeframe of 22. The panel is comprised of line staff and supervisory staff from our facilities, from the field offices, from the central office, and then mental health staff from our mental health team here at the central office. And really the goal there is to investigate and come up with potential solutions to address suicide contemplation within the system. And again, we tried to form that in a way that we could get voices from all over our system in that process and then connect them up with the mental health practitioners to come up with really practical and impactful solutions. And they had spent some time over the summer studying and trying to wrap their heads around the whole problem set, and now we're starting to develop solutions that we hope to roll out to the workforce soon.
Okay, thank you. Yeah, so that was before this latest round of survey
Yes.
data. Yeah.
Mhm.
Yeah, okay.
Yep.
And my second question is just when you look at sort of the magnitude and the broad scope of the problems present in the prisons here. I mean, you've talked about some reforms that you're trying to embark on to address those, but I wonder if these can really be if you can really move the needle on these without also having, much more public investment, and in other words, like money to put more resources into, for instance, around whether it's mental health, but also release planning and activities and things that can improve quality of life.
Yeah, I mean, certainly, I think our staffing situation is impacting all of these numbers. The surveys this year were taken in June of 2022 at Southern State. That just happens to coincide with the worst staffing situation that we were experiencing at that facility. And so I think a lot of this is these issues have existed for years and years, but I think they're amplified by COVID and then by our staffing challenges. And so we need to tackle as much of this as we can. But I think if we were to bring our staffing situation back into check, if we were to achieve stability, and then start to design our more sustainable long-term plan, which is hopefully where we're getting to soon, I think that would help in a lot of these different categories. That's not going to be enough, but I think it's a start. And I think our plan that we released and started to implement late summer really did take major steps forward for our system, and we're seeing that reflected in our own data. And hopefully we'll see that reflected next year in the PRIN survey results. And the state has made huge investments in the last couple of years, particularly on the staff side, in 2 side letter agreements outside the normal VSEA contract, really targeted investments in trying to bolster positions that we needed, primarily our facility security staff, the same group of folks who are surveyed in these surveys. But we also know that the correction system is inherently a stressful environment. It's physically stressful for staff and incarcerated. It's taxing mentally on staff and incarcerated. It's an environment that trauma is experienced on a daily basis for staff and incarcerated. And I think we need to keep that context wrapped tightly around this to understand that we can't solve it all, but we can mitigate a lot of it and address it as it's happening so that we can improve the situation for folks on both sides of that equation.
Thanks. I have a couple more, but I'll let others get theirs in first.
Great. Thank you, Derek. Pat from WAMC, Northeast Public Radio. I think you had indicated you might have a question, so the floor is yours if you indeed have one. Pat, you're on mute if you have a question. Okay.
Can you hear me?
Oh, there we go. Yep, we can hear you.
Can. Okay. The question that I have is that you're focusing on the Southern Vermont Correctional Facility. Is there any chance that the research might eventually expand, because there's other prisons in the state that, like the women's center at the Chittenden Correctional Facility, they're more focused on, certain types of prisoners and such, and they might have different types of issues that won't necessarily show up at the Southern Correctional Facility. So is there any chance of expanding this research, or modifying some of what you're determining from this research at all?
Yeah, it's a great question. And I'd like to bring Jesse in to talk about maybe some of the parameters. And before I hand it off quickly, I will say I agree with you, Pat, and I think it is important that we expand the research to other parts of the state. That may not necessarily be under the print initiative, but I think it's something the department is willing to take on. I'll highlight that during our stability and sustainability plan, or through that plan, we actually stood up, expanded, and then elevated our data and research program within the department, recognizing that we just needed to do a better job of collecting data if we're really going to understand these problems and solve them. And so that team now reports to the commissioner's office and is doing a great job of helping fill in kind of in between the surveys and answer questions for us, dig into certain pieces that we really want to key in on. But I'll let Jesse talk about just why Southern was selected, or why, there's some parameters that I think he'd be helpful to highlight to us.
Yeah, and I think that is the focus on a single facility is something that we have to own as Urban and Arnold Ventures as we came up with this. That was our guidance to select a facility. I think part of the logic there was that if this project was really going to take off, it was going to be having DOCs in general, as well as the specific facilities and maybe the research partners do a lot of things they hadn't done before, so that both on the research and on the change side, and that focusing that on a single facility would allow for that deeper work, including, and Abby and Kathy can maybe talk about this, and Brad as well as the Prison Research Innovation Manager. I mean, a lot of this work is relational, not just doing the work, but involving people in the development of the research, talking to them about what it's going to mean, getting their buy-in, listening to some of the skepticism that they might have, and also then trying to have changes that show up so that, because folks get, in the face of the challenges that they have and just, the timing that some of this can take, like anxious, like when are we going to start to see changes? So for all these reasons, although we always hoped and thought if this really takes off, DOCs are going to want to spread this to other facilities if we can prove the value, but that, we thought that the advantages of focusing in a single place and doing deeper work in that way made a lot of sense. And I will say, I mean, obviously we didn't plan a pandemic when we were conceiving this, but I will say I've thought many times, thank God we did it that way, because if we had been trying to do some of these things system-wide, I mean, I've been pleased and delighted in a lot of ways by how resilient this project has shown in the face of that situation. And if we had tried to go broader, I really think that on that express it would have fallen apart. But I think that is the trade-off. I mean, the hope is if this really is good, then naturally that would be a move that DOCs would want. It is something that's come up in Vermont as well.
Great. Thank you, Jesse. So now we can open the floor. If any folks on the line have questions, feel free to unmute. You can also use the raise hand function as well on the top bar there. But any questions from other folks in the media? And Derek, I know you had questions as well.
Sure, yeah. I think this one would be for the researchers here, but I was hoping you could expand a little bit more on. I know that taking the survey results back to those who completed the survey is part of the process. I was wondering if you could elaborate on what you have heard so far. I understand that feedback may be ongoing, but did the results where you see this sort of negative trend line in a lot of respects, did that seem to match, make sense to the people who completed the survey?
Oh, Kathy, you're on mute.
Yeah. Okay. Sorry. I unmuted and then muted. Sorry. Yeah, I think no one was super surprised by the results. And again, to reiterate the commissioner's point that we did the survey in June, which was the absolute low point with staff. And so what that meant was, that they were more restricted in sort of what kinds of things they could have, incarcerated people could have access to because of staffing issues for security and safety reasons. And so they were not terribly surprised. I mean, our commitment is to always share the results with the folks inside first, before we share them publicly, just as a a matter of respect and courtesy, and then also to get their feedback. But the next phase is going to be where we get in depth about what they think that we should know about these results, what they think they mean. So for example, if one measure got worse, we can speculate about why that might be, but we don't really know what the perceptions are of the people inside about there may be something that we hadn't considered. So that will be the next phase. So we'll be able to deepen our understanding of the survey results.
Thank you, Kathy. Any other questions from folks on the line? Okay. Well, hearing none, I think we will adjourn for today. As a reminder, feel free to email me. You should all have my email. It's in the press release. If you need a copy of the results, they're also available on the UVM site. That's linked in the press release as well. And of course, always happy to follow up over email as well to continue the conversation. But thank you all so much for your time. Thank you, Commissioner. Thank you, Kathy and Abby and Jesse and all of our partners. I really appreciate your time. And thank you so much for this project. With that, bye. Thank you.